You're listening to the Exceptional Girls Podcast, and I'm your host, Julie Withrow. As a mom who raised a twice exceptional young daughter, I know both the joys and the challenges of parenting a child who thinks, learns, and experiences the world differently. I also know how lonely it can feel and how long it can take to get answers. I created this podcast to increase awareness, understanding, and acceptance of female neurodivergence. In doing so, I hope to smooth the path for other families. Please join me for expert interviews and candid conversations about giftedness, ADHD, autism, dyslexia, and more. Let's learn together how we can make sure our exceptional girls feel seen, supported, and celebrated. In this episode, you'll meet Dr. Alexis Bidding, a licensed mental health counselor who holds a Ph.D. in clinical sexology. Dr. Alexis works with children, teens, and adults with social and developmental delays, including autism spectrum disorders, Asperger's, ADHD, nonverbal learning, and other challenges. She has extensive experience working with LGBTQ+ clients, as well as supporting young people who are questioning their gender identity and sexuality. This episode is especially personal for me. I've shared a little about my own child's gender exploration, and I even took some time away from the podcast to contemplate how I was going to proceed, since my child, who had been my muse and inspiration, no longer identifies as a girl. Where I've landed is that whether my child identifies as a female or not doesn't change how I feel about the importance of raising awareness about the female experience of being neurodivergent. I'm also hopeful that by being transparent and sharing our experiences navigating gender identity, that it will be helpful to others who are going through a similar experience. So without further ado, listen in as I talk with Dr. Alexis about our experiences, and she shares her insights and advice about how we can support our kids who are questioning and exploring their gender identities. Hi, Dr. Alexis. Thanks so much for joining us on the podcast today.
It's a pleasure to be here. Thank you.
You know, as you know, we've talked about this a little bit leading up to our conversation. This is an important topic for me because, you know, my own child, who really was the inspiration for this podcast, has gone through a gender exploration, is, I guess, how I would talk about it. And, you know, it's been a really interesting, challenging, but also kind of exciting journey for me as a parent. And I know that other parents in my audience are going through this same thing. So I'm really, you know, I think it's a really important conversation that we're about to have. And I just really appreciate you being here and, you know, sharing your expertise with us today.
Well, thank you so much for having me. And I hope I can answer any questions or provide any support as we kind of navigate this together.
Yeah, I'm sure you have a lot of insights to add that are going to be really helpful to all of us. So, you know, I'll jump right in. As a parent of a neurodivergent kid, and I think a lot of parents can probably relate to this, our kids sometimes develop special interests, right? Or they might get fixated on something, you know, a new idea, a new concept. And, you know, as a parent who's trying to support a child who's going, you know, through a gender questioning process, or, you know, really is starting, you know, to question, you know, are they a female? Are they not? What do they really feel inside? It can be difficult as a parent to know, like, is this another one of my kids' special interests or phases? And, you know, I'm just I love your insight, is since you've worked with lots of, you know, kids going through this, how we can know, right? Or if there's a way we can know, or maybe it doesn't even matter that we know, right? How can we navigate this as successfully and as carefully and as thoughtfully, and, you know, be sensitive to our kids?
That's a great question. I think a lot of parents, it's one of the first questions that parents ask when it comes to neurodivergent kids or teens, even young adults. And I do find it to be very tricky to decipher. And as someone who's been a sex therapist for some time now and works with a neurodiverse population, my question is always, how would we address this if it didn't have to do with sexuality? And any kind of behavior, right? And so when I look at a behavior, I say, okay, how would we handle this if it was anything else? And then how do we tweak it because it's related to sexuality? And I think that's a really important piece of the puzzle because a lot of times when things are related to gender and sexuality, professionals, parents, people tend to approach things very differently with a level of concern or fear, which makes a lot of sense, right? We always want to protect ourselves when it comes to our bodies and sexuality and identity and want to be really mindful of those things. When it comes to special interests, whether it's trains or Legos or gender identity or sexuality or particular clothing that someone wants to wear, presentation, expression, those can all be special interests. The first question I ask is that special interest providing any level of distress to that person? That's my first concern. If I'm have a special interest and I'm really interested in something and I'm researching it a lot, but it's taking up so much of my time that it's making my life miserable or it's making me really upset and I can't stop looking at it and I'm really obsessed with this thing, then I'm more concerned than if I'm really interested and it's providing me a level of happiness, joy, excitement, entertainment. I'm curious. So my first question is what's going on when this researching, this special interest is happening? And if it's not so great, I'm upset or anxious, then I have a lot of questions, right? So is it more of an OCD like behavior? Is it more something that it's distressing because it's causing anxiety and we want to dig deeper and get some support, like psychological support, like a therapist? We want to add someone else in there because it's providing distress, right? Not because of the topic itself. Now, if it's something that we really like and we're enjoying it, that's great, right? And we just want to make sure we're doing it really safely. So, what I find when it comes to things regarding gender, sexuality, identity, expression, sexual orientation is if you just Google those types of things, there's a big world out there of information, whether it's just Google searches and web pages or chat rooms. So things like a Discord, things like any sort of these chat rooms that people will go into, or even video games that have chat rooms and people talk about things related to sexuality. So I find that if your kid, teen, young adult has a special interest, one of the most important things is really normalizing that that's something that people are interested in. Even if that's not something that you may have done a ton of research on yourself, there's probably some level of interest that you had in. I'm born female and I identify as female, so I'm considered cisgender. There are times where I've looked up how certain people dress, how to kind of look cool when I was a teenager, what the trends are. That's really normal, right? That if it's not a special interest, I'm just kind of curious as to how that. I mean, maybe it was a special interest. I wanted to look cool as a teenager. So I was interested in looking cool. And so I do think that there's a level of normalization that is okay. And we want to keep our kids safe. So making sure that when they're researching things, how do they research things? Knowing that they can come to you and talk to you about the special interest, even if it doesn't quite make sense, so that you can monitor some of these things. Because if I'm searching Legos, that's usually the pretty generally, of course, there's some odd things out there, but generally safe space with Legos. When we're looking at sexuality, because it's such a big topic, I think safety is so incredibly important that making sure your kids are comfortable talking to you about that special interest. Now, how do we differentiate whether it's really a special interest or is it, am I on my gender journey? I really think that that validation on the front end, saying, you know what, I don't know, like let's explore, let's see what it is, and seeing what questions unfold. Is it, oh, I just really love seeing how all these people dress. That's the special interest. I like seeing this is very interesting. This is beautiful. I like this. Or I want to be more like this. Or the way I dress doesn't really match with how I think about myself, or I want to do things differently. What are the questions and thoughts that are coming up? I really like this and I want to keep researching. Or is it bringing up more questions and making me think about how I think about myself and how the world interprets me? And that might lead us more down a gender quest or a gender journey.
Yeah, that makes a lot of sense. I mean, you've said so much in there that's, there's a lot of nuggets. And I think, to your point, right? Whenever we're talking about sexuality, right? It's a pretty loaded topic, if you will. And we all bring our own baggage, I'm air quoting, to the table. And so I think it can be challenging, as a parent to just sort of hold space for your kid to have that exploration, right? And, it's also really, I really love that you said that it's actually really just normal as a teenager socially, right? To be interested in these things, right? Like, what are other kids doing? How do I find my place, socially? Who do I relate to? Who don't I relate to? And it kind of brings up another question. And it was one of the things that I know I went through was, uh when my kid was younger, they went through a very girly phase, right? Like this whole, wearing like the kind of 50s style, dresses and all the things and went through, like a Harajuku phase, that was also very feminine. So when they came to me, with this gender identity stuff, I was kind of like, what? Like, you were so girly there for a while. What changed? And I suspect that that's probably pretty typical. It's all just part of the exploration, right?
It's so common. That's probably one of the most common things I will hear from parents. This doesn't make sense. Let's say my child was born female. Doesn't make sense. They used to love wearing dresses and they used to talk about liking boys and they used to whatever, wear pink and frills and loved, do all these things. And I think about if you ever I think most people that are probably listening right now can think of a time and go back in their minds where they went through a phase and they pray that those pictures never surface, right? And they're like, oh my gosh, like went through like an emo phase, or I went through a severe tomboy phase where I would not shop in the girl section. And I'm a very girl, anyone who knows, I'm a very girly girl now. Would not shop in the girl section, only boy section, and baggy clothes. It was, I mean, I pray for those pictures never to resurface. But I never really questioned my gender. I really was questioning the expression of my gender, what I wanted people to perceive. And those are all very different things. And so my gender is invisible. Gender is inside your brain. So it's how you view yourself, right? How you think about yourself, how you want other people to perceive you is what your expression, how I look to the world, how I want people to think about me and what thoughts I want them to have about me. So those are two very different things, how I express to the world, maybe what I like to wear, versus how I identify on the inside. And a lot of times those things do match up. I identify female and I dress very feminine. And so that's very congruent for people and it's easy to digest. And most people, it kind of aligns that way. And it is easy to digest. It's what we're socialized to think. However, they really are these separate things. And when we're able to divvy them out, it makes a little more sense that one could be one and one could be the other. One could be, I could identify as female and dress very masculine or vice versa. But phases are extremely normal. And again, I think now we're talking about gender and gender identity, and which is obviously bigger than going through, a tomboy phase or an emo phase or, whatever the phases, different kinds of, like a glam phase or,
Right.
I do think most of us, or most people that we know, if we look back on like photo albums, I'm dating myself, photo albums, but photo albums, we'll see that.
Yeah, that's a really good point. Yeah, like the entire 80s would be just fine with me if nobody ever saw it, which also dates me. But yeah, and that you make such an important distinction, right? This sort of self, identification versus, kind of what is being perceived, by other folks. And I think it's a really great way to think about it because, I know some of the some of the things I went through when I was trying to, figure out if this was a real, again, like in air quotes, a real thing for my kid or not was, because, some kids, let's face it, like they know they don't fit in their body from a very early age, right? And so I always feel like, well, for those parents, it's so much easier because it was so always so obvious, right? And I don't really mean it was easy, but like I didn't with my kid, it wasn't obvious, right? Like they were kind of going with the flow for the most part. And so how do what's your response to that kind of questioning? If my kid wasn't always having this questioning, so is this just some peer pressure thing, or they go to a school with a bunch of, kids who are sort of counterculture? So is that what's happening? Like how do you help parents navigate that piece?
That's a fantastic question and a extremely common question that I hear. I have parent and there's a debate. I try to be Switzerland all the time because I can see all sides of different things. However, I'll hear things along the lines of they became friends with kids who are trans or gay, and that's why they are now identifying as trans or gay. Or the school had a speaker come talk about gay and trans rights, and so they're being influenced in some way. So it's tough because I generally think that parents, most adults, but parents really want their kids to have the easiest route possible in their life, right? I think that's just what parents want. They try to create a world in which their kids have an easier life than they had, and that they, just generally have a easier way of going. I think when you belong to the LGBTQ community, it creates hardship and on some level, right? There's discrimination. There are things that are more challenging when you belong to that community. So I also think, and it makes a lot of sense. I am concerned if my child belongs. I don't want any more things. The world is hard enough. Right? Like adding in.
Totally. You want to protect them, right? And this seems like a slippery slope.
And it is, so you want to be sure. I think everyone's like, I want to be 100% sure, if they're going to identify this way, if we're going to risk that them potentially getting bullied or something not great, or people having bad opinions of them or what have you, can we prevent that? Can we be sure? I think what's really challenging is it's really hard to be sure, right? As someone, this is my life's work. It's very hard for me to be 100% sure if someone is gay or trans, and people often change their mind, right? Or differently. I identify as lesbian, for example, and then, perhaps I start to be attracted to men a year or 2 year, 5 years now. Those things can happen, right? Or there's the so I think it's really challenging. And I do think that people's hearts are in the right place when trying to figure out how can we keep our kids as safe as possible and making sure that they're in the right environment.
Yeah,
There's
that's such an important thing, really, because it makes perfect sense to hear you say it, right? Like it helps the pieces kind of fall in place for me. I'm really just trying to be protective. And that's natural, right? As parents, we all want to try to make it a smoother path for our kids if we can. But it's also all too easy to become, even if we don't mean to, dismissive or invalidating, right? And
right.
so like I think you're doing you're really helping me sort that out right now. I'm sure it's really helpful for our listeners too.
It's really tough and really it pairs a lot onto self-esteem and just general identity. I have teens that come in here and it doesn't have to do with, any LGBTQ issues. And they're like, I don't know who I am. It's like, well, yeah, you're 12 or 13. Like, really, no, I don't know many people that do know exactly who they are at 13. And so also I think being open to that process of you're an evolving person. Like I always say the beauty of every person is they're a culmination of their life experiences and everything that's about to happen to them also. So it's a beautiful thing. And if hopefully your identity isn't stationary, that would be terrifying. If I'm exactly who I'm supposed to be now for the rest of my life, what a bummer, where's but the growth and the learning. And so, okay, where are we at now? What kind of person are we? And I think when we're looking at identity, it's so important to look at all facets, not just gender and sexual orientation, but really looking at all these pieces. And oftentimes I find that sometimes I think teenagers want people in general want to belong to a group. We all want to belong to a group. It's comfortable, it's human nature, it's evolutionary. We want to belong to a group. And so if we find a group of people that are very accepting and they all have a certain trait, it's very tempting to think that we have that trait too. And it's okay to make a mistake and think, oh, okay, like I'm this. And it's okay to explore that. So if I belong to a group of individuals who are all trans and we have a lot in common, and I start questioning, am I trans because I am aligned with all these people? There's nothing wrong with questioning that. Chances of you becoming trans because you're friends with individuals who are trans is very, 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 very slim. It's a long road, a lot of obstacles. And oftentimes, like there will be these things that get in the way and make you say, I don't know if that's really for me, right? I don't know if that's how I belong. And if it's not, if you love all these people who are trans, but you just don't quite identify, allyship, being an ally, that's how I identify. That's beautiful. You can go to all the parades, go to all the things, be wonderfully, beautifully part of the community without having to become something that you truly aren't, right? Or don't really identify as.
Yeah. And that's a really important message for the parents too, because there are probably some parents who maybe intrinsically, have a little phobia, right? And so it's also like, you can also be an ally and that's a beautiful thing, right? It doesn't necessarily, it doesn't change your identity or your sexuality to be a supporter and be an ally, right? I just, man, this, the gender and sexuality piece is just so laden with emotion, right? That it can be very hard for people to navigate. But one thing that occurs to me is one of the ways that we can be affirming for our kids is understanding the language, because
Mm.
this trips a lot of parents up. And I've also, had to learn this language. And we know, I mean, obviously, the value of having a common vocabulary is a great way to kind of bring people together, but also as parents to express, right, that we're learning, we're being, we're trying to, really be supportive and all these things. So can you help us with some of the language? Because I don't think everybody, I mean, this is new to us, right? It's sort of it's relatively new anyway. So can you help kind of break that down?
Absolutely. And I think that's such a beautiful point that you brought up as well, that what I find that when parents are able to utilize the same or similar language as their kids, or try, there's new words coming out. Sometimes even I'm like, oh boy, I that one, that's a new one for me. When parents really align on that same language, I think kids see them as really supportive, right? Okay, like not only are you saying all the words, but you're really trying, you're really learning this thing that's important to me. So it's almost, I liken it to, if I really like baseball and you're like, yeah, cool, and your parents like, pay for your go to baseball, that's cool. But if they learn the baseball teams, they learn like, your teammates' names, your coaches' names, they know the field, they know the position. You feel like your parent really cares and is really there with you. It's kind of similar, right? You could say, like, I support you, do whatever you want to do. And that's beautiful. And I love that. But if you really know what's going on, then they really feel like you're there for them and with them. And I think there's something very special there when that happens. So the most important piece, I think, that I would differentiate is your how I gender identity, right? So gender identity, kind of as I said earlier, is how you feel about yourself, like internally. So that's your gender, how I identify. And I can't see anyone's gender. No one can see anyone's gender unless you tell me. Right? And typically people will identify their gender by utilization of pronouns. So I use she, her pronouns. Uh, so I and identify female. Someone might use, so let's start with that. So we have gender identity. So I could be cisgender. I identify as the gender. My gender matches the sex I was assigned at birth. So that's usually people say, "Oh, what's your gender?" Right? And you say male or female. But really it's your sex assigned at birth is your parts that you were born with. Male, female, intersex. Right? So that's your sex assigned at birth. And when they match, when you're born female and your gender is female, you're cisgender. When it doesn't match, and there's a lot of different options for that, anytime it doesn't match, we call that transgender. A lot of times people think transgender, those are the people that got surgery to change their gender. Much more complicated than that. Transgender is anyone whose brain identifies as different than their body parts. So that could be someone who identifies as gender non-conforming, and I'll explain what that is. So gender non-conforming, non-binary, gender queer, gender fluid. Those are all slightly different versions of something kind of similar where you don't identify in the binary. So when we say binary, that's female and male. So anything that's not completely female or completely male kind of falls somewhere in the middle. So gender non-conforming, I don't really conform to either gender. Non-binary, I'm not really one of the two ends. I'm gender queer, I'm somewhere in the middle, right? Or I'm a mixture. Gender fluid, sometimes I'm more female, sometimes I'm more male, and I might go back and forth or stay somewhere in the middle. So there are these different terms and different ways to approach that. I'm overgeneralizing, but many times individuals who identify as non-binary will use neutral pronouns. And I always say neutral pronouns are your best friend. It's very hard to mess up if you use neutral pronouns. So they, them. One of the things I hear a lot is uh, I can't use they, them because that's a plural. They, them.
Oh, believe me, like this was the hardest thing, right? I mean, it's a real thing, you know?
It's very hard. I think there's a lot that goes into this. I find that if you program yourself to use they, them pronouns kind of across the board, it's once you get used to doing it, you kind of do it all the time and you just make so many less mistakes.
So, yeah, I agree. The they them thing is super hard and what you get a lot of pushback from people on. I mean, I was an English major, right, and a writer, and so like these were very hard for me, but once I started using they them, it's kind of my default now, and
Mhm.
I feel better about myself as a person. It's a very deep thing, this use of language, you know?
You almost train yourself not to make assumptions about other people. If we go way back, I think if for safety reasons, we make assumptions. We make assumptions for safety. Am I in a safe place? Is this a safe person? But really, that's not what's happening in 2024, right? We're really just making assumptions and they're very unhelpful. And so going back to some of the language, sexual orientation, who I'm attracted to, has nothing to do with my gender identity, right? Or has nothing to do with my sex assigned at birth or my expression. So sexual orientation is, am I heterosexual? Am I homosexual? Am I bisexual? So who am I attracted to, which has nothing to do with my gender identity. So that's really tough because again, we see people. And so if I'm female, let's say I'm female, you kind of know I'm female, right? But I dress in a more what we consider like butch way, right? I have a very short haircut, maybe I dress a little more masculine. You could tell I'm female. A lot of people make the assumption that I'm a lesbian. But like, why? Just because I expressed masculine, so you made an assumption that I like women. Those are all completely different things. How I express myself is one thing, right? How I identify inside is one thing. My body parts are a different thing, and who I'm attracted to is a fourth thing. So these are four separate things. And if you leave here with nothing else, and you don't even have to know them perfectly, know that those are four separate things. So your gender identity, your gender expression, your sexual orientation, and your parts, right? Who you a sex assigned at birth. Those are four separate things. And again, if there's nothing else you leave here with, know that they're four separate things and do your best not to make assumptions without information. And I always ask someone's pronouns. So I'll say, "What's your name?" And what pronouns do you like to use? He, she, they. There are these things called neo pronouns, which are a little trickier. And so those are outside of he, she, they, and they might be more specific. And if you know someone well, you may start to utilize those. But I think that, it really helps if you can. Teenagers, oh man, if you meet a teenager and you ask them, hey, like, what's your name? What's your pronoun? They already feel like they're in a safe space. They're like, oh, they're a young adult. They feel like, okay, this person, even if you don't totally get it, even if it's not really your thing, you've aligned yourself with that person and made yourself a safe person, even if you don't totally get it.
Yeah, that's so true. I mean, I really, this language piece is such a big deal. And, it's just a good reminder just to always remain curious. Like this is a very good life
Mhm.
philosophy, right? Like just be curious, ask questions, don't make assumptions, right?
Mhm. So,
So, the they that them thing was such a big deal in our own family. I mean, I'm not tooting my own horn because like I just said, it was super hard for me in the beginning, because I wanted to push against it because of grammar rules or what have you. But I actually, once I started using it, became super easy, right? And I'm also a writer, and there are times where I would use that in writing. And so when I thought about it that way, it made it much easier to get my head around, right? Like if I'm writing to an audience and I'm trying to appeal to everybody, I don't want to, necessarily use, any sort of gender, loaded terminology. So but when it comes to like our family members, right? This is a good segue to that. So, I feel like as a parent of a neurodivergent kid, we are always advocating for our kids, and particularly, in school settings, but also with our family members or our friends or others in our community who just don't, really, they just don't know yet. They're not experiencing what we're experiencing, and our kids might be quirky or, a little different, from other kids. And so I feel like we're always kind of advocating for them, whether it's socially or, for their academic needs or what have you. But with our family, our close family, like grandparents, aunts and uncles, I was wondering if there's any, I don't know, advice or insights or help that you might be able to provide along those lines.
Absolutely. I think I mentioned a little before, but I do think there's a bit of a difference between acceptance and support, right? So, when you're accepting someone, we're like, you can do whatever you want. We love you. When we say the words, we support you. Kids and teens, young adults, they really see support, right? Support is a lot of the behaviors and actions that people that love them or people that are around them, what they do to show this acceptance, right? And I think that's really important. And if we can increase whatever those behaviors are, it's going to look different in every family. One thing that I see happen a lot is particularly with older family members or perhaps more conservative family members or family members in which this belief system is maybe uncomfortable, they'll kind of keep calling the child by their birth name, whatever that is. And let's say the child's born Sophia, and now they want to be called Joe. I don't know. Typically we'll go something close. So it's like Sophia, let's go to Sam.
You can use mine. So my kid was Maddie, and now they're Remy.
Maddie. Okay. And so it's tough because I think that like if it's at like a holiday dinner, right? If we're at, Hanukkah or Christmas and we don't want to cause ripples because we don't want, it's the holidays. So someone says Maddie, and you're like, oh, like, you kind of look over at your kid and you're like, is it that big of a deal? Okay, maybe I can let this one slide. Maybe they didn't hear it, right? I don't really want to upset grandma. Grandma's 85, 90, grandma's never going to change. Right? And so we make all these excuses, and those an excuse doesn't mean that it's right or wrong. It's a reason, right? There are these reasons why it's more challenging. But if we're going to support our kid, right, in their transition and their journey, depends on the person, right? And how they tolerate feedback. And that's an important piece, right? Are they someone that gets really upset in front of other people? And is it embarrassing? Do they not tolerate that? Is that not accepted in the family dynamic? But I do think saying something like, hey, grandma, don't forget this is their new name, or hey, don't forget this is the pronoun that we're using now. Because if I'm your kid and I overhear that, I'm like, wow, like mom has my back. Like that's really cool of mom to do that. Even if grandma still messes it up, right? I hope grandma doesn't. I hope grandma catches on. But unless we say something, right? A, it's really never going to change. And B, then what our children are hearing is, oh, like these slip ups can happen and no one really cares. And I'm tired. Like, I don't want to keep having to advocate for myself and the people that love me around me. Like, it would be nice if they could support me. So there's that, right? Kind of, correcting people kindly and politely and in the best way possible, depending on the family dynamic. I think there's that piece. And I also find talking with the individual about how do they want family members to find out. Right? What's the most comfortable? I only want grandma to know, or I only want Aunt Susie to know because she's the most chill and I like Aunt Susie. So let's start with Aunt Susie. But okay, so if Aunt Susie calls you they, them, what about at Christmas dinner? What are we going to do? Or, how are we going to do this at Passover? Like, how are we going to handle this? What do you want them to say? And having these conversations, even if it's imperfect and kind of messy, shows your kid, I'm really thinking ahead about how you are going to feel the most comfortable and how I can support you the most. In addition to that, my favorite thing to work on with parents and family members is how to use gender neutral language. We don't even realize how gendered our language is all the time. And so like my daughter, my sweet baby, my whatever. And some are fine. Like I hear, those born female or male called my sweet baby, my loving, whatever like pet names are. But I'll ask, hey, I've been calling you this for a while. I consider that pretty gender neutral. Are you cool with me still using that pet name for you? Is there a slightly different one? Saying child or kiddo, or, instead of my son or my daughter, student instead of girl. How can my neighbor, the firefighter instead of fireman, firewoman, using gender neutral language kind of across the board whenever. And it's okay if you catch yourself, you're like, oh, I could have done that. And I do that all the time. I'll say something. I'm like, oh man, I could that could have been could have used a gender neutral term there. And I didn't. And if I slip up in front of a teen, I'll say, ooh, that would have been a good time for me to use a gender neutral term. And I think it would have been this. What do you think? And I'll check in. So they recognize, I don't recognize. The other part is, sorry, I have like lots of thoughts on this. If you make a mistake, right? If you misgender, I always talk with kids about how they want to handle that. I always, one of the things I say is don't make a big deal about it. So if this person wants to go by they and you say she, I say, and you go she, sorry, they, and then move on. I think making a big to do about it just puts a lot of spotlight on that person. Usually that's a good thing. So I'll suggest that. And if the family's on board, sometimes I'll do like a gender jar, kind of like a curse jar. So like anytime someone messes up, dollar in the jar or like quarter in the jar, right? Kind of like penalty. And it's a joke. And then maybe you take that money and do something as a family together, right? And you go, okay, we're gonna get ice cream together because everyone just keeps screwing up. Or like put this towards something that we want. And so I think there's lots of ways to do it depending on, level of frustration, what the tolerance is.
I love the idea of having, like what we used to call like a curse jar, like a swear jar and kind of just because this can be very heavy, right? And there's a lot of value in having, just maintaining like some levity and, a sense of humor, right? And not having to make it so dramatic all the time, you know?
Everyone's doing their best. And if you've been calling someone by a certain name for however many years, it is very hard to change that. It is hard to change a nickname. And that's just the reality. It is hard to do that. And so I think it's okay to give someone some permission and forgiveness and allowance and again, bring some levity to it.
Yeah, totally. And give ourselves that grace too as parents, right? Because the one thing I'll say that's one of the more challenging pieces for me is when I would use the term daughter, it just had this love wrapped around it. You know what I mean? It's an emotional connection term. And when I have to default to my kid, everybody assumes it's a boy first. When I use that language, it's a very interesting thing. Everybody assumes I have a son when I use that language. And I just can't find that gender neutral term that has that same feeling to it, and it's just one of those language things that I hope we figure out and maybe it will evolve. But I personally haven't found it yet, and maybe we're just not there yet.
Yeah. It's hard, and sometimes working on it together, or having it kind of naturally come out. And I think, something that we had talked about when we had first met is, how do we like, how does this evolve? Like, how do I expand my relationship with my child based on all this new information? And sometimes that's part of the fun new discovery is the expansion of how I think about you and the language I use to refer to you. And I think and it's okay for it to be frustrating in the beginning because you liked using the word daughter. Like that was something they were born, they're beautiful. The word daughter is the first word that comes to mind, how you refer to them to all your friends and family. So it's really hard to no longer utilize that term that has like a very deep emotional connection. I think it's okay to say it's sad that I don't get to use it anymore because I love that term when thinking about my kiddo. But now it's kind of cool. I get to discover a new one to think about them in this new phase of their life.
That's a great segue to another question, which is how these conversations work, which is what I love, is, as a parent, and particularly as a mom, it's so easy. We tend to put everyone else's needs in front of our own, and particularly our kids. And as I said before, when you have a neurodivergent kid, you spend a lot of time supporting that kid and advocating for that kid. So it's kind of easy to get lost as a parent and all that. But and people also who are farther ahead on the journey can be very judgmental if you express any sense of grief or, this sense of loss, right? As you navigate this process. And, I would love to hear your thoughts on that, like how we as parents can be very supportive of our kids, but still honor our own, process in this journey.
I think that it is crucially important as a parent to honor your own process. And I think if you don't, you're going to get lost in the sauce a little bit, right? Because I think it's, like you said, I do think that parents of neurodivergent kids tend to give more. Parents give like enough, right? They give so much of themselves. I think it's very easy to lose parts of yourself as a parent to prioritize parenting so much. think particularly when your child has more needs, whether it's because they're neurodivergent or for any other reason, they have more needs in some way, it's even easier to lose parts of yourself. So taking care of yourself, for me, I think, really well taken care of parents are parents that are better at taking care of their kids. Period, point blank, which sometimes, and a lot of the parents I work with will find that to be incredibly selfish. Like, well, I don't have time. Like, well, then we have to figure something out, right? We'll work together and figure it out. You like need to take care of yourself. And what is that saying? Comparison is the thief of joy, right? I think if you compare
Mm-hmm.
your parenting or where you're at in parenting with somebody else, you're never going to feel like a good enough parent, whether or not your kid is, LGBTQ or neurodivergent. You're just, I think you can't compare. You have to go on your own journey and compare yourself to yourself. Am I learning, growing, being more supportive than I, was in the past? I think when it comes to our kids, one of the most important things I believe is to really try and validate whatever's going on with your kids, even if you completely understand what's going on, because it's so easy to be dismissive of what's happening. You're
Mm-hmm.
like, I don't know exactly what you mean. I don't know what this term is. I don't know so many different things. But you know what? I'm going to learn. I'm going to figure this out. We're going to figure it out together. I do think that it's a long journey and to be okay with that. Say like, okay, this is where we're at now. And for your child, they might not know what the very next step is, or the very next step is, or if the next step's going to be easy or challenging or stressful. And so, again, self-care as a parent, whether it's going to therapy or having a really good self-care routine or having a support network, I almost always encourage parents, if it's plausible, whether it's online or in person, to attend support groups for parents that are going through a similar experience. I know here in South Florida, I have recommendations, and they're pretty much around the country, especially COVID was a big bummer, but the beauty of COVID was, so many things are now virtual and online. So it's very easy to access a lot of different things, even if you're in a more remote location. So I do think hearing other parent experiences is immensely helpful because it can feel like you're kind of in a vacuum, especially if you don't have other, you know, parent friends that are going through something similar. It just can feel very lonely and feel very overwhelming and feel very stressful. And I often have parents that feel like they're never doing the right thing. They usually are doing quite a good job, but you don't know that because it just feels like there's so much else going on. Plus, you're like, we're talking about this very specific topic, then you're like parenting. Just parenting is a lot, right? We're talking about this very niche, like a piece of parenting, but I think I know tack that on top of just the everyday things. That support is immeasurable.
Yeah, it really, yeah, it is. And I think you're right. I mean, I think parenting can be very lonely regardless.
Mhm.
When you're parenting a kid who is different, it's even more lonely, and you kind of learn early on who is a safe space and who isn't, right? So I think finding those safe spaces, while it can be difficult, it certainly is much easier than it used to be, even with Facebook and different places, right, where you can find these communities. And I do think it's so important. And I'm good at preaching it, not always great at living it, right? But really taking care of ourselves and and not with our kid necessarily, just with ourselves and in our own safe spaces, give ourselves, that time to reflect and really, go through our own feelings about it, it is so important, but it can be difficult, right? So I could talk to you, for hours about this probably because in fact, I know I could because this is such a great topic and such a personal topic for me, that this has been so helpful and so eye-opening. Um, so before we wrap up, I love to ask my all my guests the same question, and you've already answered it a little bit, but maybe this phrasing will either give you an opportunity to kind of affirm that answer or maybe add to it. But it's when it comes to giving parents who are supporting a daughter who's exploring her gender identity, her sexuality, what's if you could give those parents one piece of advice for for how they could be most supportive of their daughter through that process, what would that be?
There's so many pieces. I think the biggest piece would be be kind to yourself and patient with yourself because of the process, right? I do think, I had said before, I think a little making sure to take care of yourself in terms of self-care, whatever that looks like. It can be, again, talking to someone, joining a support group, but taking that time for yourself is going to make you the best version of yourself for your daughter, for your kid, for your child. And I think that's, the best version of you is going to be the best version for them. And so whatever that looks like, I do think, and also maybe even challenging yourself as to what some of those beliefs are that might be getting in the way. I always find that we don't always take the time. I don't know about you, but for me, before I became a sex therapist, or during the process, it's like, what are some of the messages that got delivered about sexuality? And like, you think you really have done that work until you sit down and you're like, whoa, actually, some weird messages are really, you really think about it, and it influences how we view the world. Some we're proud of, some we might be less proud of. But doing that work and thinking about, my gosh, like, what are those messages? And then how do I take care of myself? How am I the best version of myself? Is there any support that I need? And how can I, not just be someone who accepts my kid, but really supports them? And what are some of those things? I know we talked about some today, and there's so many different ways. And talk to your kid about it. I'm sure they'll have some suggestions also.
Yeah, I love that answer. I do think there are these phases that you go through, and acceptance is the hardest part. So, if we can start with support and kind of, break that down and take it a day at a time, a week at a time, and a month at a time, right? As someone who's kind of farther along on the journey now, looking back, I can say that that's really the only way to do it. So you have to give yourself some space and grace, right? Just to be able to navigate that. And I think, yeah, I mean, I just think it's so important that we do take time out for ourselves to do that work, like you said. And it's not always easy or comfortable to do that work, but it really is important for us to kind of do our own self-exploration about what these things mean to us and why, and is that real or is it not real, right?
Mm-hmm.
So I love that answer. Well, this has been such a great conversation. I've learned so much. I have a feeling that our listeners have also learned so much. So thank you again, Dr. Alexis, for doing this. It's really an important conversation, and it's just been great to have you on the podcast.
Oh, thank you so much. It was so great to be here. I really appreciate you and everyone's time. So thank you.
Thanks for tuning in to the Exceptional Girls podcast. If you liked today's episode, it would mean the world to me if you'd subscribe, leave a rating and review, and recommend it to just one other person who you think would benefit from listening. Even a small act of support helps the podcast reach more people, which in turn helps increase awareness and understanding of exceptionality in girls. And if you have suggestions for future episodes, please share them. You can connect with me, your host, Julie Withrow, through our website at exceptionalgirlspodcast.com/contact. And that's a wrap. Ciao for now.